So what about earlier stage bladder cancer, for example, muscle invasive bladder cancer? After a patient gets cystectomy or chemotherapy plus radiation for muscle invasive bladder cancer, the main question is, has the cancer come back? And typically what we use to determine whether the cancer has come back is imaging, such as a CT scan. However, CtDNA introduces the concept of minimal residual disease, meaning bladder cancer that has come back and is present, but we can't see it on the CT scan. Minimal residual disease, also known as MRD, can be detected in either blood or urine. And one of the ways that we can do this is through CtDNA. Previously, before the advent of CtDNA, one of the tools that urologists and oncologists used to predict whether a tumor would come back was pathologic complete response on the surgery, meaning that patients who had a pathologic complete response were less likely to come back. But CtDNA measured after the surgery in one study was actually found to be more prognostic than pathologic complete response. So this is something that your doctor may request be done to determine if the cancer has come back. We can also use CtDNA to monitor for minimal residual disease after surgery. The idea behind this is that it can actually detect a bladder cancer that has come back before imaging can. In one study that had 68 patients, for patients who were CtDNA negative following surgery, they had a 100% chance of being cancer-free at 2 years and a 100% chance of being alive at 2 years. Whereas the patients who were CtDNA positive, while not all of them had their cancer come back, they were at higher risk of the cancer coming back. Therefore, patients who are CtDNA negative either following surgery, before surgery, or before neoadjuvant chemotherapy, meaning chemotherapy given before the surgery, have better prognosis overall. And this is another tool that your oncologist or urologist can use to determine whether the cancer has come back or it would be likely to come back. Now, recently, for patients with high-risk disease, we've been using adjuvant immunotherapy to prevent a bladder cancer's come back. Adjuvant meaning treatment that's given after surgery. Typically, this adjuvant immunotherapy is nivolumab, an immunotherapy that's given for 1 year. Now, there's another study with atezolizumab called IMvigor010 that showed that there was no benefit for adjuvant atezolizumab, an immunotherapy. But what they did see is in the CtDNA positive patients that there was better survival overall. So looking at the graphs on the right, the top two lines, the light red and the light blue line, are the CtDNA negative patients. The CtDNA negative patients in this study did better than the CtDNA positive patients, similar to the last slide that we talked about. Both these patients did well overall, so giving adjuvant atezolizumab made no difference whatsoever. However, for patients who are CtDNA positive, on the whole, these patients did more poorly than the CtDNA negative patients. However, the CtDNA positive patients who were given the immunotherapy did better than the CtDNA positive patients who were not given the immunotherapy, seeing that the CtDNA positive patients is where this benefit may actually be. So the next logical step that we're doing is, can we use CtDNA to select patients who should get immunotherapy? So patients will get surgery, then they'll get CtDNA measurement. If they're CtDNA negative, no immunotherapy, but CtDNA positive, they'll be considered for immunotherapy. And there's 2 clinical trials out there that are looking at this question. One's called IMvigor011, and the other one is called Tombola. So we're going to actually have an answer, and this may better select the patients who should be getting this adjuvant immunotherapy treatment.